Hi, and welcome to the Aesthetics Health Hub. Today, Jill and I are back again, and today we've decided that we're going to speak about
weight management. And I think, people maybe identify us more with our aesthetics clinics because that was the foundations of what we do. But we do much more than that. We offer medical services as well because we are HIS registered clinics. We're regulated clinics and we are healthcare providers. And one of our passions is medical weight management.
Yeah.
And we both offer that as a service
Yeah.
within our clinics.
Yeah. And I think predominantly Monjaro and Wegovy are probably our two most popular parts of the service that we offer.
Mm-hmm. But
So
we're not just prescribing services.
We're absolutely not.
So we're going to do a little bit of a dive as to, how we can support our patients on their weight
through
loss
that
journey.
100%.
And how it differs perhaps from some of the online services. But we also need to acknowledge that there's also a lot of rogue non-medical services out there that are selling weight loss medication from under the counter.
Yeah.
And I'm not saying that frivolously because we do hear that it's literally under the counter.
We've had their patients come to us.
Here's your pen and off you go. Without due diligence.
Yeah, so it's important to discuss that and explain what exactly we do.
Mm-hmm. Yeah. And how it does differ.
Yeah,
and
hugely.
It just hopefully gives you a little bit of an idea of the differences in the services. And we know that online and the under-the-counter medications do tend to be, I guess, a cheaper option for people. And that might be what persuades some to go to these providers.
However, or in an instance that I had, she didn't think she would have warranted the BMI tablet. However, she did, but she went and got the drug under the counter and it cost her double what I would charge. And that's because they knew they had the market for, and it's well known that you can just go to this practitioner and you'll get it under the counter, no matter what your BMI is. So they're actually charging more. So that's like double whammy. That's like just not on.
So we'll do a little bit of a dive into how we do it.
Absolutely,
how we offer our weight management service. And we have been doing it for a number of years. 2019, I think, I first did my course and then started to offer it as a service. So we've got, a fair wee bit of experience with these types of medications because they're not new. They've been around for a long time.
Definitely,
It's a new phenomenon.
Yeah.
But let's explore it.
There's an instance for our weight management clinic. So our initial weight management clinic, we take baseline bloods. And unbelievable what we've picked up just through doing baseline bloods. So, we had one lady come in and it ended up, there was a list of 7 things. She was type 2 diabetic. She had really high cholesterol. She was hypothyroid. The list went on and on and on. She was anemic. So there were 7 things we picked up. That woman was a sitting time bomb. And she probably wouldn't be here a decade later if we hadn't picked that up.
How was her GP at picking that up at the other end, though?
He was actually good. So what we did, she did say to us, I don't know if the GP, if he'll do, I said, well, he has to do something. He has a duty of care. So we wrote them a letter and we gave the letter to her and we said to her, go up, give that to the GP and then ask for an appointment. Didn't get a face-to-face, unfortunately. She did get a telephone appointment, though. But at least they already had my letter there. So as soon as they read that and they did the telephone appointment, there was no way that they could have said no to that. She really did need treatment.
Because we're not GPs, but
no.
what And, you know, this
We're
is...
facilitators.
Yeah. And I think this is the misconception quite often about medical aesthetics. We also do other things. And a lot of us have got, you know, a vast amount of experience in medicine.
Been in advanced practice.
Yeah. And, you know, we can only diagnose within our scope of practice, but we also have the other clinical skills and clinical knowledge to be able to perhaps identify an issue.
And signpost.
Yeah. But also empower our patients to, you know, take their issue that's maybe been screened and we've picked up on to their GP.
Yeah.
Some of them, I mean, it sounds as if that lady, you know, got a really good service from the GP, but you'll know yourself.
Yeah. Depends on the GP,
yes.
Unfortunately.
And some will say, oh, that was done privately, you know, But as you say, there is a duty of care there. And if something has been picked up, then there should be a duty to follow that up. And I think sometimes there's maybe a little bit of resistance between GP practice and perhaps, you know, the private sector. But let's be clear, GP practices are private enterprises.
Absolutely.
They just have NHS contracts.
Yeah, exactly.
You know, and certain targets that they have to meet in order to, you know, continue to, you know, be subsidised for providing that care. And I do think going forward with, you know, the constraints that and the demands that we do have on our NHS services, that we could be very much playing a part in.
I think we're an advantage and we should work hand in hand and they should work hand in hand with us. I mean, that lady, for instance, she actually came for the slimming drug Monjaro. Now, if I had done slapdash consultation or if she had gone to an online pharmacist, none of that would have been picked up. And that lady would have been in serious, serious trouble starting Monjaro with all that list there. So that would have then had a knock-on effect because she would have ended up in hospital. So we're actually saving money to the NHS by picking these things up earlier. And I think you're right. I think, you know, they need to work hand in hand with us and, you know, work as a service, not as them and us, definitely.
I mean, one of my ladies very recently approached me to ask if I would prescribe Wegovy for her. So this lady is type 1 diabetic, but she's got a high BMI. She's really, really struggled. I mean, she exercises. She tries to watch what she's eating. But she's finding it really, really, really difficult to shift the weight. She's quite active. She actually has quite an active life. So she recently spoke with her consultant and she had been on the continuous pump system and there was a failure in the pump system. It's now apparently going to be getting withdrawn from use. She went back onto giving her own insulin and managing it herself. But the consultant has now suggested she goes back onto the pump system because then it would be a little bit easier to manage if she went on to Wegovy because he's quite happy to do that and also quite happy to prescribe it. But here lies the issue. So she can get the prescription from her GP. However, she is now being considered for the waiting list for the weight management clinic in the NHS, which is about 12 to 18 months. So she could get her medication just now, but she's going to have to wait. So they're going to have to wait until both of them are ready at the same time. So she she did approach me, and I was like, well, yeah, as long as we have a shared agreement, you know, with your consultant, I would be happy because they would be monitoring, you know, your response to your going back on the pump again, and your diabetes side of things, and I could help manage your Wegovy. But why should she pay for a private prescription when all she's waiting for is that support, which I could give her, which would be, you know, she would obviously have to pay for that part of the service, but it would be way less in her prescription. And actually, I've got a background in addictions. You know, I'm used to working with behaviour change models, you know, nutritional support. In fact, she knows what she needs to be doing nutritionally, and she's actually very good at doing that. And I've got a body scanner, which is probably more than she would get. The time that she would have with me would be more than she would get in the NHS. And it's so at the moment we're trying to navigate that to see if we can have some sort of an agreement with our consultant that her GP will prescribe her Wegovy, but she comes to me for her weight management, and then we can just get going with this because this has been ongoing for such a long time. And so, when the systems are out of whack and out of sync with each other, and somebody's having to wait that length of time when there's a prescription sitting there ready for them, it's so frustrating.
Yeah, absolutely. No.
You know, what we're also seeing is people who are losing weight, you know, either on their own or with weight management medication, and that they're coming to us with obviously quite significant volume loss. And changes in their skin because they're maybe not supplementing as well.
Definitely, yeah. So I think our weight management clinics, they're just a total game changer for our patients, I feel. You know, people are losing. I've got some people, they've lost 8 stone. And, it, you know, it's given them mentally, they're in a better place. But physically, you know, it's lowered the risk of cancer. They're lowered their coronary heart disease risks. You know, there's so many benefits
just
that we're seeing.
Physical nature of losing weight on joints and
absolutely,
even being able to get into a plane seat. You know.
And I think remote prescribing is banned for aesthetics, but my personal view is I think it should be banned as well for weight management, because we're getting people coming to us that had bought it through online pharmacists, and their BMIs are well over 30, so they fitted the criteria. But because the support's not there, they're just meeting up when it's time for another pen, and there's no real support in a lot of these online pharmacists. They're having medical symptoms that are freaking them out, and they're going to their online pharmacist and they're saying, you just need to go to your GP, whereas we can pick these things up and point them in the right direction. Or, you know, I had a lady that had classic, she had in her history we took to begin with, never had gallstones, was fit, young, 40-year-old, great, overweight, but otherwise no medical history. And she was on Mounjaro for about a month, and then she started coming in with upper right quadrant pain. So on examination, after I took the history and examined her physically, I was like, we need to stop this. She was gutted. I'll be fine. I'll just take painkillers. No, you won't just take painkillers. You know, in my mind, I knew she was heading down either gallstones or heading into pancreatitis. Now, sent her to a GP, and it's actually after taking bloods, found out that, she has got pancreatitis. So she might have just continued with that. And,
thinking it's just a side effect.
And if the pharmacist said, just go back to your GP, she would have been, oh, no, I'll just keep going, I'll take painkillers. You know, she was losing weight, so she was desperate to keep on it. And I was like, no, I think you have gallstones, and I think you have symptoms now of pancreatitis. So we need to stop this. And if you don't stop this, this is what will happen. Pancreatitis is
life-threatening.
Exactly. So once you then explained that to her, she was like, oh, right, okay, right, no, I'm happy to stop that. Whereas through an online pharmacist, would they explain all that to them? I'm not sure that they would. So I think we're seeing more and more people coming to us that because we're giving them that support, I would say definitely.
But there's something, in that about face-to-face as well.
Yeah.
Because we know that people can, underestimate, they can tell little white lies in order to continue with their medication.
Oh, 100%.
Especially,
Yeah.
weight loss medication.
Yeah.
And we hear these stories all the time. But when somebody's sat in front of you, you know as well as I do that you pick up on the non-verbal cues as well. And it might also be just, how somebody's look. They might look a bit ashen. There's just something that's changed about them. Their skin tone might have changed. Their hair loss. There's things that we may pick up on, or there will be things that we'll pick on a face-to-face consultation or review that is it's just not going to be feasible through a tick box form exercise. And the online pharmacy services, and it's not all of them because some of them are ethical, but we also know that people were jumping about from pharmacy to pharmacy, especially when they still had the higher BMIs.
And given online codes for discount, which is illegal, by the way.
So no one is really monitoring these individuals who are jumping about from pharmacy to pharmacy because they're just going for wherever the best deal is. And then what we're also seeing just now and getting feedback from it is that when people get their BMIs down, to a significant healthier level, a kind of cut-off point, some of the pharmacies are just saying, we can't prescribe for you anymore.
Yeah. There's no support then.
There's no support. There's no maintenance plan whatsoever. It's just a cut-off. Now, you know as well as I do that when you're, teetering off and titrating down medications, it's not just a physical reduction. There's a psychological aspect to it as well.
Yeah.
Because people become very attached to their support mechanism and their support system. And if that support system is a medication, then the idea of it just stopping is
and
really
there is
scary.
no reason why they can't stay on a microdose of it. None. I mean, you take, you start on medication after you've had a heart attack. Just because you're feeling better, they don't take you off all that medication. Obesity is a disease, and it's a recognised disease by the World Health Organization. So why, some people, don't get me wrong, some of our people have done really well just coming off it because we've got them into that mindset where they are determined and they've completely changed their lifestyle.
And we've been working with them for a long time at that point.
100%. But then there are some who will never come off it. And there's nothing wrong with that. We just titrate them down till we get to a level that's manageable. Because there's lots and lots coming out now to show us that it has other benefits as well.
Reductions in inflammation.
Exactly. And you see that with your
hormones.
arthritis patients as well. And
cortisol levels coming down, people feeling less
100%, yeah.
That's something that they always say, even when the first couple of weeks, they say, I do feel as if I'm less... They might not have lost weight as such, but there's something shifted and they can...
Definitely.
They can definitely feel
psoriasis. I have a lady who had horrendous psoriasis and she's been coming to me for other treatments for years, and it was scalp, it was all over her arms, all over her legs as well, and her psoriasis is completely gone. Completely
That's amazing.
Gone. Not a bit of psoriasis. And that in itself, as a woman, you can't go without, in the summer with bare legs, you've got to keep your arms covered, it has totally changed, transformed that woman totally, as well as the weight loss.
Yeah. And I think, you know, when people have got down to their optimum weight loss, or, you know, a beneficial BMI, they've reduced a lot of their risks. And, you know, that's going to be different for everyone. Some people will be happy to maintain it at different levels of acceptance of where they are at that moment in time. But there is actually no clinical guidance of how we do that.
Exactly. And I think it's very much individually tailored to that person. That's what I find, you know. Some of my ladies are on a higher dose and can't get down. Some of them have titrated it down. You know, you are then prescribing it off license, but that's acceptable. And as long as you advise your patients that whatever dose we're doing from now on is off license, and they agree to that, there's no reason why you can't. You know, we prescribe off license in NHS for numerous drugs, for whatever reason, you know. But it's just getting that right dose for them as a maintenance dose. But we still see them back every 2 weeks, like yourself, you know, and we still, you know, we still have that discussion about, right, your water, your
protein, your diet, your exercise.
Exactly, yeah. What are you still doing, you know, and we still do yearly bloods on them just to make sure, because people will tell you fibs.
Yeah.
You know, and if you do yearly bloods where you're looking at all their vitamins, their minerals and everything, and checking their kidneys, you'll not be long in finding out if they are doing what they're saying, you know. And you have to remember that Mounjaro and Wegovy slow down gastric emptying, so they are more prone to these deficiencies.
And I mean, we're coming up to the Christmas period as well. And this is the time, and not just this time, but holiday times as well, where we're talking about strategies for the Christmas period. And I don't know about you, but I do hear this quite a lot in holiday times, in particularly Christmas, where people are like, do you know what? I might just stop my dose because I'm going on that all-exclusive holiday. I might not take it before I go. And, you know, it's that mindset of, I've paid for it, so I want to enjoy it. You know, and I want to overindulge. And like, but why should it be any different just because you're going on holiday?
Exactly.
Part of this process is not to deny yourself. This is about relearning to live in moderation.
100%, yeah.
You can still have all of these nice, tasty foodstuffs and, you know, a little bit of alcohol, but in moderation. You don't, you can still enjoy it, and it's a complete mindset. And it's the same at Christmas time. I'm, you know, I've been hearing it the past couple of weeks as well. Well, I'm going to this one's and that one's, and I've been to this night out and that work lunch and all the rest of it. Like, that's okay. And you're allowed to enjoy this festive period. However, keep it in moderation. And with being on the medication, it supports that moderate, you know, way of approaching food and behaviour. And if they come off it, then that potentially is just going to
just escalates and takes them back to where they were.
Exactly. And it takes them back to that point of, once the Christmas period's over, they're going to feel guilty. You know, they're going to be self-deprecating. They're absolutely going to hate themselves for having put on a stone or even a stone and a half. Because, you know, you can, not just with this medication, but, you know, at any time, even if you're not on it, on, you know, the GPL ones, you can put on quite a significant amount of weight. And then it's all the stress and the worry of trying to get it all back off again. And just, if you're on it just now, continue.
Stay on it.
Stay on it, you know, through the festive period.
Definitely.
There's no difference.
No, absolutely not.
But we're battling a mindset. And that's what needs to change.
Yeah, probably just want to say thank you as well to everyone who's listened and got right to the end of our conversation. And it's been another great day.
Yeah.
Yeah. Thanks, folks.